Hello, my name is Malika Charles, and this is my presentation on HIV/AIDS and the National HIV/AIDS Strategy. HIV/AIDS. Human immunodeficiency virus, or HIV, destroys cells that fight diseases and infections. In turn, it weakens an individual's immune system. Hello, my name is Malika Charles, and this is my presentation on HIV/AIDS and the National HIV/AIDS Strategy. HIV/AIDS. Human immunodeficiency virus, or HIV, destroys cells that fight diseases and infections. In turn, it weakens an individual's immune system. Currently, there is no cure for this virus. However, with appropriate medical care, HIV can be managed. There are many factors that attribute to the susceptibility of some groups in the United States acquiring this virus as opposed to others. For example, factors such as sexual partners, risky behaviors, and where the individual lives may increase the likelihood that they may acquire this illness. HIV/AIDS in America. According to the Center for Disease Control and Prevention, there are more than 1.2 million Americans living with HIV infections. In addition, 1 out of 8 individuals, 12.8%, are not aware that they have the virus. The groups of people that are more vulnerable to HIV infections are gays, bisexuals, and other men who engage in intercourse with men, or MSM. Moreover, young Black/African American MSM are more affected by HIV. Also, the Black/African American community experience the most severe burdens of HIV. HIV/AIDS and Black/African Americans. The Black/African American community in America experience the most effects of the HIV crisis. For example, Black African Americans are diagnosed with AIDS more than any other racial groups and have more HIV-related deaths. Blacks make up about 12% of the American population. However, this particular group represents 44% of the new HIV infections in 2010. Moreover, African Americans account for 41% of the individuals living with HIV in 2011. An estimated 270,726 Black people with AIDS have died, and an additional 6,540 in 2012. Factors that contribute to the HIV/AIDS epidemic. The leading factors that contribute to the HIV/AIDS epidemic in the African American/Black community are poverty, lack of information, injecting drug use, and stigma about HIV in Blacks. Poverty. African Americans are more likely to be uninsured or have public insurance than Caucasians. The lack of insurance limits the access to information, testing, and treatment for HIV, therefore leading to increased hospitalizations. Lack of information. Many individuals may be HIV positive and unaware of it and spread the disease unknowingly to others. In addition, distrust of the governmental source of information and research is still prevalent as a result of the Tuskegee syphilis study. Injection drug use has been proven to increase the spread of HIV via blood and lead to risky sexual behavior. Stigma and HIV in blacks. Some people in the African American community are misinformed and they believe that the HIV is a white/gay disease. These views have been a barrier when it comes to educating and discussing HIV statuses. Addressing HIV/AIDS in the Black/African American community. The growing HIV/AIDS cases need to be addressed to help preserve and educate the Black/African American community. Through education and the access to proper health care, the number of new cases of HIV/AIDS may decrease. In July 2010, President Obama proposed the National HIV/AIDS Strategy, NHAS. The purpose of NHAS is to coordinate the efforts of federal agencies, community organizations, and other healthcare organizations to respond to the HIV epidemic. In addition, this updated 74-page strategy document from the White House was created to guide the U.S. HIV/AIDS response through the year 2020. The four primary goals of the NHAS are reducing HIV incidences, increasing access to care and optimizing health outcomes, and reducing HIV/related health disparities. Achieving a more coordinated national response to the HIV epidemic. The National HIV/AIDS Strategy, NHAS. The vision and aim of the NHAS is for the entire U.S. population's well-being. The vision of the NHAS states, the United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race/ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfiltered access to high-quality life-extending care, free from stigma and discrimination. This strategy has transformed the way Americans communicate about HIV, prioritize and organize prevention and care services locally, and provide clinical and non-medical services that support people living with HIV. There have been many important accomplishments that has resulted in a positive impact on the HIV/AIDS epidemic due to the implementation of the NHAS in 2010. The benefits of the NHAS are as follows. Widespread testing and linkage to health care, which will allow people living with HIV access to care, services, and treatments earlier. Extensive support for people living with HIV to remain engaged in comprehensive care, which involves support and treatment adherence. Complete viral suppression among people living with HIV and universal access to comprehensive pre-exposure prophylaxis services. The National HIV/AIDS Strategy costs. The NHAS linkage to care objective has increased the life expectancy of individuals with HIV by 0.4 years and delayed the onset of AIDS by 1.2 years. The early linkage to healthcare services and treatment costs an extra $62,200 per quality adjusted life years. Moreover, the highest amount that could be cost effectively spent on early care prevention is $5,100 per HIV diagnosed persons. The NHAS is the most efficient policy developed to counteract the HIV/AIDS epidemic in the Black/African American community. Even though this approach to the growing problem is designed to impact all individuals with the illness, it will have a greater effect on this community since they make up the largest percentage of individuals with this disease. The aims of the NHAS are in the best interest of the American citizens and is cost-effective while improving life expectancy and the onset of AIDS through access to earlier healthcare services. All levels of government should support this strategy because it uses a cooperative approach to controlling the HIV/AIDS epidemic. Thank you.